more women are overcoming infertility through a new minimally invasive surgery. Here to explain how it works is Dr. Robert Biter and new mom Alyssa Edwards, and Kira here. And you had the surgery. Good morning to both of you.
Good morning.
Let's start with you, Alyssa. We have to talk about this beautiful baby right here. Tell us about Kira.
Kira, she was born January, and I had the surgery in 2008.
Okay, and you had some trouble conceiving.
Yeah, 3.5 years.
3.5
Yeah,
years.
it took us 3.5 years.
So I imagine this is really a bundle of joy for you. Yeah. Now let's talk, Dr. Biter, about the procedure. I was surprised to hear there are a lot of women out there with uterine fibroids, or fibroids, is that even right?
Fibroids. Right.
And it affects the ability to conceive, and I don't know, do many women even know that they're having a problem with this?
Well, the statistics say that 3 out of 4 women have fibroids within their uterus, which are benign growths inside the uterine lining or inside the muscle of the uterus, and many of those women are completely asymptomatic. However, in women attempting to conceive, they find either they're not conceiving or they simply have miscarriages.
Okay.
So
Alyssa's story is pretty typical.
Yeah, Alyssa's story is pretty typical for the practice. We do a lot of minimally invasive gynecology, and you know, make no mistake that we don't decide who gets pregnant. We're not the ones who make this miracle happen, but we simply push the envelope in women's favor. Most reasons of infertility are unexplained.
Right.
But for women who have fibroids, there is an explainable, treatable, and preventable cause of miscarriage.
We'll talk about the treatment in a minute, but Alyssa, how frustrating was it for you to try for 3.5 years and not have the answer as to why you couldn't get pregnant?
It was really hard for us to go through it, and it's a miracle that she came after the surgery.
Are you hungry? Yeah.
I'm hungry too.
I know, we're all hungry. We'll get you some food in a minute. Doctor, tell us about the procedure. There's been some changes in the treatment.
Absolutely. So uterine fibroids used to be removed, either open surgeries or using procedures that had electrical energy.
Yeah.
And what we found is that electrical energy increased the risk of scarring.
Yeah.
And so this unique procedure is one in which we're able to use a scalpel, essentially, within a tube, which will remove the fibroids without using electrical energy. So it's minimally invasive. It's made by Smith & Nephew, and it's the only equipment available on the market that won't cause scarring. Because if you remove these fibroids and then the uterus scars, you're actually worse off than you were previously.
So that's really critical here.
Absolutely. It uses the technology that we use for athletes, million-dollar athletes who have their knees scoped or their shoulders scoped, because you certainly don't want scarring there either. And so we use that exact same technology for women inside their uterus to preserve the anatomy. And
that this procedure changed your life, basically. We want to let you know that Kira went off for a little bit because she was a little fussy there, but yeah, it changed your life.
It did. It did.
Talk about being a new mom and how much that means to you.
She's just a little bundle of joy, just a miracle, and so happy that I did have the surgery, and I didn't even know that I had a fibroid until Dr. Biter did an ultrasound on me and we found it. So, and I had a couple miscarriages before that, so it's just a whole miracle.
Yeah, definitely have gone through a lot to get here. What about insurance? A lot of people are concerned whether or not this is covered because so many things to treat infertility are not covered. Is this covered by insurance?
It's absolutely covered by all insurance carriers. And I think the important thing to emphasize is that most people who have miscarriages feel guilty, or they feel that they did something wrong, or they ate something wrong, or they...
Did you feel that way?
Yeah.
And so, you know, what I would like women to understand is that, number one, it's not their fault. Number two, there is hope. And for them to push their physicians. So if their physicians don't have an ultrasound to identify these fibroids, and they're told simply, it happens, try again, perhaps they need to seek out alternative options, because there are curable reasons for infertility. And we have excellent colleagues in this area who do in vitro fertilization. But even IVF, or in vitro fertilization, or test tube babies won't be successful if there are fibroids. So, you know, it's really to give women hope and to make them feel empowered, and to forgive themselves of the fact that some miscarriages do happen. And there are times when they happen that's beyond our control, and they may be genetic, or they may have those beginnings of life may have problems, and that's why miscarriage happens. But when there is a curable, identifiable, easily treatable reason, then those women should be afforded that opportunity.
They should pursue it. Well, I hope a lot of women watching today, or some that are having issues, may take this extra step now that they know this procedure is available.
Yeah.
Dr. Bider, appreciate it. Great to see you.
Nice to see you.
Congratulations.
Thank you.
Oh, there we have a shot of little Kira. That's right, a miracle baby. All right, Alyssa, thank you so much for coming in
Thank
today.
you.
Congratulations.